Despite ongoing control efforts, the Union of the Comoros has one of the highest leprosy rates in the world.
Jawad, il n'y a pas de tout, c'est un cas de lèpre. Avec les boutons là sont les nodules.
Although leprosy is often considered a disease of the past, this infection continues to wreak havoc in more than 120 countries, including the Comoros. Leprosy is a chronic and debilitating infectious disease caused by a type of bacteria called Mycobacterium leprae. Leprosy affects the skin, the nervous system, the respiratory tract, and the eyes, and can cause physical deformity. Research from 2018 shows that more than 7 patients per 10,000 population in the Comoros are infected by leprosy. Many people affected by leprosy face stigmatization and discrimination.
J'ai perdu, ce sont parmi les conséquences, j'ai perdu la mère. Je me sentais vraiment très difficile. Je me sentais comme si j'ai perdu ma vie.
The bacteria that causes leprosy multiplies very slowly in the body. On average, patients do not show symptoms of the disease until 5 to 20 years after they first became infected. This can make it difficult to control the disease. Leprosy is curable, and treatment in the early stages can prevent disability.
Après que cette opération est finie, la guérison est venue.
The WHO target for the elimination of leprosy as a public health problem is defined as a prevalence of less than 1 patient per 10,000 population.
Ici aux Comores, la lèpre est endémique, il y en a beaucoup de cas. Nous dépistons annuellement plus de 300 cas de lèpre dans cette île. Et nous, notre objectif, c'est de faire en sorte de dépister tous ces cas à temps pour essayer de réduire la possibilité de développer des incapacités, c'est-à-dire des mutilations, pour que ces malades-là ne deviennent pas des invalides. Donc notre objectif, c'est de chercher des partenaires un peu partout pour que nous puissions effectivement non seulement de traiter, mais aussi de prévenir donc alors cette maladie, et c'est ça ce que nous sommes actuellement en train de faire.
Therefore, the National Programme for the Control of Tuberculosis and Leprosy of Comoros, supported by the Damien Foundation, reached out to the Institute of Tropical Medicine in Antwerp, Belgium. Since 2017, these partners have worked together to find a way to tackle leprosy in Comoros through innovative research and capacity building. The People Project, which commenced in 2019, contributes to leprosy elimination by supporting and providing scientific evidence. This project uses active door-to-door screening of households on the islands of Anjouan and Moheli to detect as many cases as possible.
On fait le porte-à-porte dans chaque ménage et puis on regarde les gens. Et si on trouve quelqu'un qui on n'ose pas dire devant tout le monde, mais on ramène, on sensibilise, on lui montre des dangers, on lui explique tout et voilà, ça passe.
The newly detected patients are offered curative treatment. This method of systematically identifying people with the disease improves patient outcomes. It also facilitates the identification of people at risk of developing the disease. These are people who may have had close and frequent contact with a patient but do not yet have signs of the disease.
On a pris une petite partie pour aller faire l'analyse. C'est les lames aussi pour la biopsie. Oui. On va tout de suite fixer et puis envoyer au laboratoire colorer, lire et puis envoyer ça là-bas.
In addition, this project is testing different strategies to prevent the disease from developing in people with non-visible infection by comparing different strategies for the distribution of preventive treatment. also called post-exposure prophylaxis.
Et avec l'appui de l'Institut de médecine tropicale d'Anvers, nous menons une nouvelle stratégie qui vise effectivement de travailler et d'identifier d'autres médicaments pour prévenir la maladie, ce que nous appelons prophylaxie, c'est-à-dire des médicaments visant à protéger la population qui sont autour de ce qu'on appelle du cas index. Cela veut dire quoi? Du malade. Si on a un malade dans une famille, donc il faut faire en sorte que même s'il a transmis la maladie à d'autres, et ces d'autres-là n'ont pas encore développé la maladie, on peut stopper pour que la maladie ne se développe pas.
The various tests used to diagnose leprosy infection are being thoroughly evaluated to improve laboratory testing capacity. Some patient samples are tested in the Union of Comoros, others in the lab of the Institute of Tropical Medicine in Antwerp. ITM supports by providing lab material and training of laboratory technicians during the study so that eventually all tests can be performed in Comoros.
Cette recherche nous permettra non seulement de réduire la maladie, mais il nous donne aussi les moyens pour que nous puissions réellement travailler sur le terrain.
Researchers in Antwerp are also analysing the genetic fingerprint of the leprosy bacteria detected in patients from Comoros to better understand the transmission of the disease between patients, patient susceptibility to treatment, and the development of drug resistance. Thanks to this research, the Comorian Leprosy Control Programme has been significantly strengthened and expanded, and the cooperation with Damien Foundation and the Institute of Tropical Medicine Antwerp has been reinforced. The knowledge of experienced personnel is systematically passed on to the younger generation. The People Project enables us to screen 70,000 people at risk of leprosy annually on the islands of Anjouan and Moheli. The project is an example of a successful, effective and respectful collaboration between partners with different expertise who work towards a common goal.